definitely a little bit of give.
Yeah.
This will suck. Yeah, sorry.
That's all right.
All right, so we're seeing this patient for right shoulder atrophy along the mid-back and also scapula. So we're kind of looking at external rotator right here, and probably, if I had to guess, some of the rhomboids that are under it due to some radiation in 2008,
yeah,
right? And then shoulder surgery a year earlier, which was for the cancer too, or just another?
That was before we knew it was cancer, so they went in and did arthroscopy to try to repair like regular wear and tear, thinking that that was going to solve it. So it really was nothing. A surgery for no reason.
Go great, yeah. So our goal today is going to be to see what we can do to improve this atrophy and any other issues that come along with it. So full disclosure, this is actually my sister-in-law that we'll be treating today for her shoulder atrophy as a result of her cancer treatment way back in 2008, 2009, just for the radiation. Any chemo treatment she got is affecting her more and more now. Cancer can be kind of tricky in terms of what results we can expect, but we're absolutely going to try using some of the facilitation principles to get those muscles activated, as well as hypertrophy principles in terms of regaining that muscle size and strength. All right, arms up overhead, good. Actually face that way so we can see if there's anything there. And then down, and then like a snow angel.
Down? Oh, like this?
Yep.
Okay.
Good, that feel okay?
Yeah.
Reach across. Good, any issues? Oh, just by itself. Any issues there?
No, tighter.
Tighter?
Tighter here.
Gotcha, other side.
Not
just
tight.
by itself.
Not tight.
Okay. Behind your back like that.
This is a good one.
Good.
This is what I got.
Oh wow. Okay.
And like you can grab it and like get about to here.
Yeah.
You feel it up here. Any more, I mean the whole thing doesn't work.
Yeah.
But I said I can do this, and I can. This is where I feel resistance. I could force it to do a little more.
Okay.
That's about it.
So that's some good information. So like I said, like I was just talking to the camera, so obviously there's a visible part that's right here, which is like the external rotator cuff muscle.
Okay.
Underneath of it though, I'm gonna guess, radiation doesn't just go in the front of the bone, it goes behind it.
Yeah.
This muscle under your armpit is essentially just attaches to the front of your shoulder blade.
Okay.
And does a lot of this.
Okay.
So that will probably be affected, but we'll take a look at that on the table. Now, obviously from the last clip, you saw that the most obvious lack of muscle or atrophy is in her external rotator or her infraspinatus, which is basically the bottom half of her shoulder blade right there. But what I'm wondering, and what I'm also seeing with her functional screen, is that she might also be missing some muscle deeper in that area. So like her subscapularis, which is another rotator cuff muscle, but on the front of the shoulder blade, as well as possibly lats, rhomboids, mid-trap, things like that, that if they lose size, it can kind of seem like the shoulder blade is almost sinking in and giving the appearance that the external rotator is the only problem when that may not be the case.
Well, and to answer your other question, I had radiation in here. So like it would be, if you were looking at my back, it's this side of my back, kind of like this shape. And then I always had like a scar here from where they shot it this way.
That makes a lot more sense.
So there you go.
Yeah.
All right, what do you got?
So don't let me pull your arm up to the ceiling.
Okay.
Good. And don't let me pull it out towards me.
Okay.
There we go, that was a good one. Let's try that first one again, just to try to match it a little more.
Okay.
There you go. Okay, so that will actually need a little bit of help anyway. So now the pokes, basically I'm going to those muscles that I just tested, all of them.
Okay.
And I'm gonna try to wake them up basically. So I'm actually like trying to irritate the nerve that attaches to the muscle to make it fire. So the first goal while we're on the table here is to provide facilitation. Basically, do the muscles provide a contraction when I prompt them to by resisting against them so that they actually turn on and get used when we want them to perform movements. So that's gonna be the first step, is actually seeing, can these muscles turn on? Can I get them to turn on after I kind of poke at her and wake them up? And then we'll be able to get better use during the exercises that will be leading more towards hypertrophy or growing the muscle back.
Okay.
Irritate sounds like a bad word, but like I said, just wake it up.
I've heard worse words.
And then in terms of exercise-wise, I have some ideas already for what we'll need to do. I'm sure we'll get a couple surprises.
Okay.
But we're gonna go over method of how you do them.
Okay.
It's probably gonna be a lot heavier than you're used to. But here I'm prepping her for how I want her to perform the exercises after we get off the table, just to kind of get it in her mind what we're looking for. In terms of hypertrophy, what we actually need to do when we're exercising, whatever we're doing or what muscle we're targeting, we need to get as close to failure or to failure to actually stimulate that muscle to grow. If you could have done 5 more reps in your set, chances are you're really not going to be getting that much benefit unless you're really a beginner and you're just kind of getting into the weights for the very first time. You'll start growing. Anything after that though, it can be really tough to gain muscle. And with her issue of the radiation, we want to give the best stimulus possible to get that muscle back so she can get a good result.
Fine. As long as there's a reason.
Yep.
Okay.
Good. Feel okay? Mm-hmm. Cool. All right, switching sides.
It's gonna hurt like hell on this side. That's what I've already decided.
The poking or
the poking?
Okay, yeah, maybe.
No, it is.
We'll see.
No, it is.
Don't push your hand to the ceiling. Oh yeah. So just for reference, let's go back to the other side.
Do it.
I want you to feel how the difference in terms of your strength, right? Don't push your hand to the ceiling, right?
Yep.
Pretty solid, right?
Yep.
Then straighten that out a little bit. Don't push up to the ceiling.
Yeah.
Just like
I can feel, and this is true of most of them, I can feel myself using other muscles to try to make it happen.
Yeah. So the table, like laying down here, makes it a little harder to do that.
Yeah.
Which is nice to see what's actually giving you issue.
Right.
All right, so that's going to be mid-back.
Okay.
Mid-trap. Don't push this one this way.
Okay.
Not as bad, but still needs a little help.
Mm-hmm.
Don't pull down towards me. That's pretty solid. Feel okay?
Uh-huh.
Okay, so just mid and lower trap, mostly mid-trap affected. Not the big guy in the neck,
okay.
which is a good sign. Let's get this guy. This is internal rotators. I'm trying to turn your hand out like that.
Okay.
Don't let me. Okay. That one's usually the strongest. Good news. Not as horrible as I would have thought.
Okay.
Definitely a little bit of give.
Yeah.
This will suck. Yeah, sorry.
That's all right.
So for the videos, I always try to do a hook, like the first 5 seconds. That's gonna be it.
Yeah.
One more time. Yeah. Do you still feel like you're fighting to use other stuff as you do that?
Not so much.
Okay.
Just because there's not so much pressure to work against.
Okay.
And if I know it's coming, you kind of isolate it to do it better, right?
Exactly. That's where if you were fighting against me, that's where you would be like, okay, use every muscle.
Yeah.
Definitely under the armpit for sure. A little bit is really, I mean, not too bad, which is a good sign, right?
Yeah.
In terms of the spot that's the most noticeable.
Yeah.
But I think just the stuff under it is probably
holding it together.
No, that's probably what's atrophying more.
Oh, I see.
Causing it to sink in almost.
Yeah.
So, granted, all this stuff is a little bit weaker than I would like, but it's not oh my God.
Yeah.
Right. So that's a good sign.
Right.
As long as you have that contraction there, the nerve is still working, the muscle is still there. So the good thing that I'm finding is that her muscles are responding to the test. She's giving me a decent amount of resistance with each test, which tells me that there is still working nerve in the muscle and that the muscle is still able to provide a contraction, even if it's a little bit weaker than I would like. There's nothing drastically weak or completely that she's unable to do. So that gives me hope that we'll actually be able to stimulate the muscle and help grow it a little bit so she gets the results she wants. Come on up. Let's real quick check the arms, I'd say. So let's do straight up overhead, forwards. Good.
Forward.
Feel okay?
Yeah.
Down.
Like this?
No, just put your arms down. Like
down.
Snow angel.
Okay.
Feel okay?
Uh-huh.
Reach forwards across you.
Across?
Sorry. Like this.
Got it. Okay.
Is that okay?
Yep.
Switch sides. Good.
Yep.
Now behind your back. Easy there. Okay, tiny bit more.
Yeah.
Now, when it comes to atrophy, we're going to try to do the opposite, right? Which is called hypertrophy.
Okay.
Basically, make the muscle bigger.
Okay.
Right? So in order to get that, there's a couple things we want to make sure we're doing when you're exercising to maximize that.
Okay.
When it comes to hypertrophy, there's two main things that you need in order to stimulate muscle growth. Number one is mechanical tension, which is just basically fancy words saying that we need to hit you at the right angle so that we're actually using and targeting the correct muscles that we want to work. And number two, like I said, motor unit recruitment is something that's basically just trying to get the maximum activation out of your muscles, which is where that failure point comes in. So you want to be getting really close, like 1 rep away or even 2 failure for your sets for hypertrophy so that you get the most muscle activation possible and it stimulates that growth. Just get you as close to failure, like you could not do another rep as we can.
Won't that make the other muscles try to step in though?
That should be fine as long as we're targeting those guys.
Okay.
Right. We'll do a little bit of isolation work, but we'll also do a lot of just as long as these muscles are working, a bunch of other stuff can work too.
Okay.
Again, as long as we're putting tension on those muscles.
Okay.
Okay. So what's important is getting like, we're gonna go for like 8 reps.
Yeah.
Where you could not do a 9th.
Okay.
Does that make sense?
Yes.
Or you have like, you could do 9, but you would be totally.
It wouldn't be a good 9.
Yeah.
Yeah, yeah.
So reason we're going for 8 versus 15.
Yeah.
As soon as we get over 8, your fatigue and soreness just gets a lot worse.
Okay.
Which is not great because I want you doing this like several times a week
Yeah.
to maximize what we get.
Okay.
That makes sense?
Yep.
So you may not have heard this before because you technically can grow muscle from anywhere between like 4 reps all the way up to 30 plus. Like I said, as long as you're still getting close to that failure mark. But what happens when you do 8 or less reps and still get close to failure is that your body actually accumulates less fatigue so that you'll be able to come back stronger and do it again later that week. Versus if you're doing 30 reps, your body's gonna accumulate a lot of calcium ion, a lot of lactate, which can hinder or slow down your recovery and make it harder for you to do that same exercise or the same routine later in the week, because we want to hit that multiple times during 1 week so that we can get our maximum growth and maximum muscle gain. There you go. Oh, good. And this can be set up with bands wise, like base of your van or whatever. And you'll have recording of it.
Perfect.
Feel okay?
Yes.
All right, keep going until we get to that 8.
I think that was 8.
Okay.
Like that?
Yep.
Okay.
Perfect. Feel okay?
Yeah.
4, 5, 6, 7, 8. Good. Okay. Yeah. So, in terms of like muscle growth, the stimulus you want to provide is I need a lot of resistance.
Yeah.
Less important for isolation.
Okay.
Does that make sense?
Yeah.
Because your body's like only grows for the signals that you give it. So
got it.
if it's like, okay, this shit's heavy and I need to be strong enough to move it.
Yeah.
I need to grow muscle with it. But if this certain muscle's like, it's kind of heavy, I'll grow it a little bit.
I gotcha.
But it's, it's not that hard. So,
okay.
So we need heavy shit first.
Yeah.
Isolation second.
Okay. All right.
That makes sense?
So
A, T, Y. Good. Feel okay?
Yeah.
A, T, Y. There's 2. We'll go to 8 of each.
Okay.
There we go. A little bit lower.
Okay.
There we go. Yep. So that'll more so target the mid-back. That face pull will get more around like this area. Feel okay?
Mm-hmm.